Hello, Sheehy team members, and thank you for joining us for a special webinar today hosted by the AHA all around managing stress. Stress happens, especially when we have so many competing demands in our daily lives. How we eat, move, and manage our day to day pressures has a big impact on both our physical and mental well being. At Sheehy Auto Stores, we're proud to partner with the American Heart Association to advance health and hope for our team members, families, and friends. Throughout the year, we offer programs that help you prioritize your health, like our pedometer challenge and participating in National Walking Day and our She Has Heart Dealership Rewards program and competition, and by providing you access to special, helpful, healthy tools and resources like today. Each May and June, we take it a step further with our She Has Heart Sales event, where we contribute to improving and saving lives by getting involved and raising awareness and funds for the AHA during our biggest event of the year. In this segment, we'll explore the connection between stress and heart health and share some practical ways to help you feel your best every day. Today, we're excited to hear from Sula Antonio from the American Heart Association and Dr. Stacey Neal, a psychiatrist with Kaiser Permanente. Thank you so much for joining us.
Hello, Sheehy Auto Stores team. I'm Sue Antonio with the American Heart Association, and I'm so excited to be here with you today. Over the years, Sheehy has made an extraordinary impact, contributing more than $3.3 million to advance life-saving research, innovative solutions, and policies that help build healthier communities. These investments also fuel local programs and CPR education, supporting hearts right here every day. We're deeply grateful and just as proud of the ways that you continue to show up for your own health, starting with taking a few minutes to be with us today. As a part of Sheehy's ongoing commitment to your well-being and your hearts, we're thrilled to welcome Dr. Stacey Neal. Dr. Neal is a physician and psychiatrist with Kaiser Permanente, and she brings a compelling perspective on how stress impacts both the mind and the heart. I know you'll walk away with insights that you can put into practice. Dr. Neal, we can't wait. Take it away.
Thank you so much. Welcome. I'm so happy to be here talking again with you. I appreciate the invitation back from Sheehy and from the American Heart Association. And I really appreciate you all taking time out to learn more about managing stress and how that actually affects your heart health. So there's a lot here on this slide, but it's a nice summary of what we're going to be talking about today, stress and how it affects the body and the brain. Stress is an unavoidable part of life. And it can have negative impacts on mental health and heart health. But with the appropriate tools, we can mitigate those risks, decrease risk for high blood pressure, strokes, heart attack, depression, and anxiety. So here in the United States, we are among the most stressed in the world. I think we work long, hard hours, and we sometimes don't use vacation time. There's workplace stressors like finances, job security, perhaps conflict with coworkers, and these can all be as harmful as secondhand smoke to our health. And work-related stress is associated with a 40% increased risk of cardiovascular disease like heart attack and stroke. And I want to add that in childhood, we're given time for recess and play, and in adulthood, no one tells us to take time out to manage stress, but it's just as important for us to have time for recreation and play as it is in childhood. Chronic stress doesn't have to be our norm, and we can manage our stress and reclaim our time. And it's not only beneficial for our mental well-being, but as we'll discuss today, it's going to have a great positive impact on your cardiovascular health. Let's talk about some tips to help you stress less. So, one of the best ways to manage your stress is to get some physical activity. Physical activity strengthens your heart, but it also immediately produces a reduction in cortisol, which is going to help you to sleep better, help you to feel less anxious, improve your mood and energy levels. Another tip is to incorporate meditation, a meditation routine into your schedule. A regular meditation practice is associated with reduction in blood pressure levels, reduction in symptoms of depression and anxiety, and improvement in your sleep. Um, a third tip is to add a gratitude practice, and this can be as simple as just writing down three things a day that you're grateful for. And there's evidence that having a gratitude practice actually rewires your brain for happiness. It improves sleep, and it's another tool to decrease symptoms of depression and anxiety. Positive self-talk is another way to help you to stay calm. It can be a normal instinct to think negatively about a situation when you're under stress. But if you can take a moment to reframe your thoughts to a more positive and realistic thought, you can actually have a positive influence on your own emotions. And that's going to have a positive influence on your heart health by reducing your heart rate and blood pressure as well. And lastly, staying active, and this is separate from your regular exercise. It's not enough to, get 30 minutes of exercise if you're going to be sedentary for the rest of your day. Um, being Prolonged periods of being sedentary is associated with an increased risk of obesity, diabetes, and high blood pressure. There's this saying, sitting is the new smoking. So you want to make sure that you're getting up and moving throughout your day, even when you're not exercising. So if you're at your desk for prolonged periods, perhaps you could set a timer to remind yourself to get up and move around once every 30 to 45 minutes. And so next I want to go through a few realistic scenarios to help us to recognize how stress affects the heart and to teach some simple evidence-based habits that improve cardiovascular and emotional health, especially during times of uncertainty. So scenario one is about Maria, the caregiver. Maria, 54, cares for her elderly mother while working part-time. So right away we see that she has the stress of taking care of her mother, which is probably a full-time job in and of itself, and she's also working part-time on top of that. She skips meals. She sleeps 5 hours a night, which is not enough, and she's feeling constantly on edge. She smokes occasionally to calm down. So we see that she's using some unhealthy coping mechanisms to manage her stress. So what signs show Maria's stress is affecting her heart? Well, we can see that the stress is already causing her to feel on edge, and she's choosing some habits that are going to negatively impact her heart, like smoking, not eating well, and not getting enough sleep. And perhaps choosing is the wrong word, but the stress is driving her to those particular behaviors. So next, which behaviors increase her cardiovascular risk? So again, the behaviors that the stress is driving her towards are also the same behaviors that are increasing her cardiovascular risk, including the smoking, not sleeping well, and not eating a diet that would nourish her body. And what small changes could Maria start tomorrow? Uh, probably the best thing she could do for her heart health is to stop smoking. It sounds like she's smoking occasionally, so she's not, it doesn't sound like she has a hard addiction to nicotine, which can be very difficult to quit, but that would be my first recommendation. She could also start perhaps taking short walks throughout her day. Perhaps she could bring her mother on a walk if her mother is able to do that, or if she's in a wheelchair. She could reach out to a support network that can be very helpful for stress management, perhaps to give her some respite from caring for her mother. And if her appetite is low, I like to recommend that people maybe try having, small things like fruit or smoothie, things that are easy to digest when the appetite is low. And sometimes when you stimulate the appetite in that way, the appetite can actually start to improve. So the takeaways from Maria's case are that chronic stress fuels unhealthy behaviors like smoking, overeating, and inactivity. Stress causes physiological strain, raising the blood pressure, inflammation, and the stress hormone cortisol. And small, consistent habits like breathing, walking, and short breaks will reduce Maria's heart risk. So the next scenario is James and the job hunt. So James, 45, lost his job and he's drinking more. So that's an extremely stressful position to be in, unemployed, and the financial stress that goes along with that. And he's drinking probably to help him calm his anxiety. He's eating fast food. He's sleeping less. He often skips his blood pressure medicines to save money. So, how does stress and lifestyle change affect heart risk? So, right away, we can see in James's case that the stress of losing his job has pushed him towards some unhealthy lifestyle choices, including the alcohol use and perhaps the fast eating fast food may be a change for him as well. And unemployment may be leading him to be more sedentary than usual. He's probably lost some social connection and structure because of the job loss. Conversely, positive lifestyle changes like exercise and choosing a healthy diet are going to improve his heart health and decreases heart risk. What low-cost stress management strategies could help? Uh, One low-cost strategy that could help James is to perhaps uh, go to the grocery store and buy fresh foods rather than eating fast food every day. He's going to save money that way. It may take more time, but it's going to be healthier meals that are going to be less likely to increase his risk for diabetes and heart disease. Instead of alcohol to help him manage his anxiety, he could consider starting a meditation practice, which is free. There's lots of free guided meditations on YouTube or on the Calm app. I would also recommend that he start exercising, and that doesn't have to be expensive either. There's no need for a gym membership. Getting outside for, a 15 or 20-minute walk is an excellent way to get some physical activity. If it's done outdoors, there's bonus points for that because being around nature and green things naturally helps reduce cortisol, which reduces anxiety. So the takeaways are that psychological distress accelerates hypertension and diabetes, often because of some of the habits that go along with being in distress. And stress drives unhealthy coping like alcohol and inactivity. Stress can contribute to high blood pressure risk factors such as poor diet and drinking too much alcohol. but you can fight stress with healthy habits such as exercising regularly and getting enough sleep. So, scenario three is Tasha and the tight deadlines. Tasha, 37, works two jobs. That sounds very stressful. Her smartwatch shows heart rate spikes during stressful calls. She says that's just work. In my experience, when people are working two jobs, they're either working two shifts in one day or they're working 6 or 7 days a week. So either way, they're not getting much time for recreation or relaxation and sleep. When does normal stress become dangerous? So, normal stress becomes dangerous when it leads to prolonged increases in blood pressure, which can increase your risk for heart disease, can increase your risk for stroke. Normal stress, again, can drive you towards unhealthy behaviors like drinking or smoking, or being overly sedentary, or eating an unhealthy diet. And those things also increase your cardiac risk and can become dangerous. And what micro habits can reduce reactivity? So in this case, when she's on a stressful call, it could be helpful to do a breathing exercise. An example of a helpful breathing exercise might be to take an inhale for a count of 4 or 5 and hold the breath for a count of 4 or 5. Exhale for a count of 4 or 5 and inhale. And that's something you could easily do while you're still on a call or after the call is over, without bringing too much attention. But it can quickly help to reduce your heart rate and blood pressure and help you to feel more calm. Um, it can be helpful to, recognize how she's feeling, and before she goes on to her next call, maybe get up and stretch or readjust her posture if she finds she's slouching a lot during the day. These are all micro habits that can help reduce her reactivity. So the takeaways are that acute stress reactivity does predict poor outcomes. So this, when we say the acute stress reactivity, that points to, that elevation in heart rate that she noticed when she was on her call. So she's emotionally reacting to the stress, and that is a predictor of poor outcomes like heart attack and stroke. Mental stress induced ischemia is real and independent of physical stress. So that when we talk about ischemia, we're talking about a lack of oxygen rich blood flow back to the heart. When the heart is pumping so quickly that it can't efficiently perfuse its own tissues with oxygen rich blood. And that can happen just as a result of stress, emotional stress. And micro relaxation techniques like breathing, taking short breaks, and posture resets can blunt the stress response. They can help you to feel more calm and lower the heart rate and blood pressure. So scenario 4 is David, the night owl. David, 60, works night shifts, drinks coffee late, probably to stay alert during his shift, and he has mild hypertension, maybe from the coffee, maybe from the lack of sleep. He feels fatigued and irritable. And in my experience, night shift work is often accompanied by trouble sleeping when your shift is over during the day and trouble staying awake during the shift. So, how do sleep and stress interact to affect heart health? So, sleep and stress are closely linked. Um, a lack of sleep will be associated with an increase in the stress hormone cortisol, which is going to cause elevation in heart rate and blood pressure. It can also be associated with obesity, which can lead to diabetes. And conversely, when you're stressed, that can impact your sleep. It can make it difficult to fall asleep if you're feeling stressed, ruminating about a problem, if your heart is racing. These are all symptoms that can affect your sleep. And so there can be a vicious cycle between stress and sleep that does negatively impact heart health. So, what simple sleep habits could improve his stress resilience? So, night shift sleep is a special case. You have to take a lot of care to get good sleep when you're on a night shift to improve the response to stress. Some helpful tips for night shift workers are to wear dark shades when you get off of your shift so that you're not exposing yourself to the bright sunlight, which is going to affect your circadian rhythm and make you feel too awake to go to sleep. When you get home, allow yourself a few hours to wind down after your shift. Maybe do some breathing exercises, some stretching, perhaps listen to a meditation. These are going to help you to wind down and feel sleepy, and also help with managing stress. Um, Room darkening shades, white noise, and earplugs can um, uh, help you to get a better quality sleep if you're on night shift. And he can have coffee, but I would say to limit it to the beginning of his shift rather than drinking it throughout his shift. Again, that the caffeine can increase anxiety. It can affect the sleep if it's too late into his shift, and affect his appetite as well. To the takeaways, poor sleep amplifies stress hormones and blood pressure. Even shift workers can create healthy circadian routines with consistency, and wind down rituals, including stretching, music, deep breathing. These all enhance recovery and heart protection. And so we received some questions from Sheehy Auto in advance of the presentation today, and I'm going to run through those questions now. Question number one: our jobs are fast-paced and stressful by nature. How do we know when stress is just part of the job versus something that's actually hurting our heart? So stress is a normal part of the job, but um, you know that it's hurting your heart when you're starting to have physical symptoms. Like you may have headache from high blood pressure. You may feel your heart racing. You may be seeing emotional signs of stress, including irritability and anxiety. If stress is affecting your sleep, again, that's closely linked to negative effects on the heart. So if you're starting to see those signs, it's a good idea to check in with your doctor, and again to utilize some of those techniques that we talked about, like exercise, eating a good diet, a breathing exercise or meditation, and perhaps taking some time to do something that's going to be fun for you and rejuvenating for you, to not allow that chronic stress to affect your heart negatively. Uh, Question two: I don't have time for long workouts during the day. What are realistic ways to reduce stress at work without leaving the dealership? So I want to say first, before you start your day, I would recommend, if you have the time, even just 10 or 15 minutes to get a workout in before your day. That's going to set the tone for your day. But there is a lot of benefit if you're at work and you want to get some physical activity. There is a lot of benefit to what's called workout snacks, and it's not the kind of snack that I would want, but it's short bursts of vigorous activity. You could set a timer for 1 minute, and do squats or high knee lifts. There's actually evidence that short workout snacks can be as beneficial as like a 30-minute workout. Um, Another realistic way to reduce stress at work is a breathing exercise. You could do a breathing exercise anywhere. And again, it can be as short as 1 minute to start to have some meaningful effects on how you're feeling. Question three, sales targets and customer interactions can be emotionally draining. Does emotional stress affect the heart differently than physical stress? So, yes, emotional stress does affect the heart differently than physical stress, unfortunately. Emotional stress can actually be more damaging because it can be more difficult to recover from. Um, and what I mean by that is physical stress can produce sort of a short-term, transient, increase in your heart rate and blood pressure. Say, for instance, after a period of exercise, you would expect that the heart rate and blood pressure are going to drop normally. But emotional stress, we can linger on a problem, we can ruminate, and even the thought of the that stressful customer interaction can cause you to feel cause you to feel the physical effects of the stress. For instance, the rapid heartbeat, maybe feeling irritable, maybe keeping you awake at night. So it is really important to take emotional stress and distress seriously and to take appropriate actions to help yourself feel better emotionally. Question four, how does stress affect sleep and how much does poor sleep really impact heart health? Stress does affect sleep to a great degree. And poor sleep, we know that poor sleep is associated with elevated blood pressure, which again can increase your risk for heart attack and stroke. So getting good sleep is crucial. It's a crucial part of managing your heart health as well as your emotional well-being. What's one small change we could start this week that would make the biggest difference for stress and heart health? If I could do just one thing, and if I could recommend just one thing that's going to make the biggest difference, I would say walking. And I say that because you can incorporate so many of the stress coping techniques into walking. You could do a breathing exercise while you're walking. You could listen to music or listen to a meditation while you're walking. You're getting some physical activity, and walking in and of itself tends to help. Tends to help one feel more relaxed. And again, bonus points if you can do it outdoors, because the green spaces are going to help you to reduce that stress response, which, as we discussed, is going to be very impactful for your heart health. So, final summary, stress is a cardiovascular risk factor just like blood pressure or cholesterol. Behavior and physiology both matter because stress changes your biology and your habits. But small, consistent tools like breathing, walking, connection with friends and family, and good sleep compound into better health. And in my experience working at Kaiser Permanente, things that help our patients to de-stress and live longer are our focus on preventive screenings, cutting edge treatments, and chronic disease management. Our integrated care model means that we physicians, specialists, and mental health teams all work in the same system, which reduces fragmented care, missed follow-ups, and stress for patients. and access to 24/7 medical advice and virtual care options help patients to stress less about getting care. And so this is a nice summary of some of the great ways to de-stress. And so we'll run through these quickly, these options quickly. So getting out of the house in nature again can be very helpful for blending that stress response. Connecting with family and friends regularly is an important way to manage stress. If you have a pet, uh, having a pet is shown to help reduce your physiological reactions to stress. Sleep, as we discussed, is crucial. Mindfulness and meditation are excellent ways to manage stress, and exercise is also going to help you emotionally and physically. And so I want to thank you for taking time out for this important topic today. And I hope that you'll put one of the tips into practice this week. And I wish you well. Thank you.